Welcome to the New York State Association of Counties webinar on overcoming challenges in child welfare, addressing county recruitment and retention struggles and strategies for enhancing outcomes and timeliness. My name is Jeanette Stanziano, and I'm the NYSAC Director of Education and Training. I want to welcome you today and thank you for making time out of your busy schedules to join us for this important topic. Today, we have the benefit of having experts from the Bonadio Group. I have to say, in my 30 plus years of working for NYSAC on events and educational trainings, that we have worked consistently with Bonadio as experts in many, many fields, especially the finance field. So we're thrilled to have them join us today. They're an incredible asset to our association's education and training wing. And we're glad to have them here today to talk about this very, very important subject. I would like to just give you a couple of housekeeping bits of information that we have for every webinar. We record these webinars and we post them about an hour after the webinar on the NYSAC website at nysac.org under webinars. You will also find a PDF of the slides and the recording. If you have any questions during the webinar, I want to encourage you at any time to please submit them via your dashboard. Just click on the questions tab and type in your questions. They will be addressed at the end of the program during a brief Q&A. And we will read them out to our experts and get live responses. So please feel free at any time to type in your questions for our presenters today. I would like to introduce our speakers, Josh Bills, Manager of the Bonadio Advisory and Consulting Division, and Courtney Handy, Director of the Bonadio Advisory and Consulting Division. I would like to turn the program immediately over to Joshua, who will begin the presentation, and then we will hear from Courtney. Joshua, you should have control of the board right now.
Okay.
Bottom left, hover, got it?
Oh, okay. There's just a little lag there.
You want to bring it back up to the overview?
Yeah. Jeanette, how do I go back? I apologize, I'm not familiar with this software. Okay, there we are. Right there, Courtney. Child welfare experience, right?
No, can you go back a little bit more? One more slide. Yeah, there we go. Okay.
There we go.
Thank you. So Jeanette, I appreciate it. She provided the introductions of us. We're going to go into kind of a deeper dive into our background and exactly, what we've been doing in child welfare for pre-COVID, really. Then we're going to get into these three kind of hot topic areas: critical issues in recruiting and retaining staff, the operational and fiscal impacts of technology, as well as policies, procedures, and protocols. Yep, next slide. Okay, so as we had mentioned, we do have over a decade of experience in these comprehensive child welfare reviews. So we've been doing them for quite some time, and they're pretty extensive. We've done urban counties, rural counties, large counties, small counties, upstate New York counties, downstate New York counties. So, we've really seen kind of, a ton of, we've seen a ton in this time. So typically these reviews stem from a couple different things. Turnover in leadership, potentially there's a new commissioner, a director of services, there's a high profile incident, typically a fatality that has triggered our involvement with these reviews. And then any sort of concerning statewide metric or pending OCFS PIP. So typically we are brought in from one of these three reasons. And so what we do, you might think, like, what are a bunch of essentially traditional accountants doing coming into child welfare agencies, as the experts? So our engagements are pretty extensive. There are periods of, between 6 to 12 months. And so what we do, we have a foundation of our baseline procedures. So we perform one-on-one interviews with staff and management. We do some pretty extensive case review of CPS, preventive, and foster care. We do use the OCFS OMA tool as a guide. We evaluate policies and procedures, internal controls, and then we analyze essentially a bunch of data. But the real driving force in our procedures really comes from the interview. So typically we come into these organizations, people are naturally a little bit hesitant to talking to us, but once we start talking to people, I think, people start saying, oh, they're actually like very reasonable. They're really just here to help. We're not looking to point fingers. We don't look at cases and then go back to, Cindy, who made notes 12 months ago, and ask her why she did something. But again, we're looking for these interviews. They're confidential of what's going to drive our remaining procedures. So it could be, we go into one county, we hear a lot of issues with salary. We go into a different county, salary isn't even mentioned. Or we hear, in one county that there's a ton of problems with legal and communication with them and protocols. Again, another county, they've got great communication, they work together, and there are no issues. So again, we really rely on these interviews to drive the bulk of our engagement. Again, we do use the OMA tool as a foundation, but we also incorporate additional best practices and some gaps that we find in other counties. We pull that in and we assess those as well. And then again, as we find issues, we're continuously speaking with management, getting ahead of things. You don't wait to get a very extensive report 9 months later with all the gaps we've identified. We highlight all of the best practices we're seeing and all of the gaps. And then again, working with management to provide really some real feasible recommendations. Slide it over to you, Josh, for the next slide.
Yeah. Okay. First section I'm going to talk about today is critical issues in recruiting and retaining staff.
Josh, you're kind of quiet. You're a little bit quiet. Is there any way you could turn up your volume?
I'm not sure, but let me see here.
Maybe you're fine. Maybe it's just me. All right, you sound good.
Okay. So in this section, we wanted to identify widespread issues facing most child welfare departments that we've encountered. Now, these won't be news to you, but that poor recruitment, turnover, and leadership challenges are areas that are affecting child welfare departments today. But we'll go over some current statistics with each of those, and then also highlight states and groups that have made tangible progress towards mitigating the effects of these areas, right? I know I have this problem. I know there's this issue in my department. Yes, we have turnover. Yes, we have challenges in recruitment and continuing leadership, but what do I do about it, right? What's the solution? What can I do going forward? So we're gonna look at several case examples of states and counties that have implemented changes to their programs to try to mitigate the effects of these issues. So some basic stats here. The Child Welfare League of America found that the average caseworker turnover in a child welfare department is between 20 and 40% annually. And in challenge districts, if there's increasingly issues going on in one particular department and there's a snowball effect, that can increase to over 50%. Now, just yesterday, the U.S. Department of Health and Human Services released their report on child maltreatment. So this is the report that comes out annually. It lists all the statistics related to child maltreatment for each state in the United States, at least the states that participate in the program, and gives their evaluation of where we are statistically from a child welfare perspective. And this might be fresh information, new information to you, because it did just come out yesterday, conveniently, on the U.S. Department of Health and Human Services website. You can check it out there. But in that report, it was stated that in 2023, there were 4,399,000 CPS referrals made in the United States. That's the latest data there is. It'll take them all year to tabulate 2024. That's a 3% increase from the prior year. And the first year since pre-pandemic time that it has exceeded the levels pre-pandemic. So in 2019, there was 4.3 million reports. And then obviously during the pandemic years, it decreased quite a bit. In 2020, decreased 9%. And then it gradually went back up to where in 2023, there was approximately 4.4 million referrals made to CPS. So there's a steady increase there from what we had seen over the last several years. And similarly, there's stress in the system that's observed in the average response time for CPS referrals. The report indicated that in 2019, the average referral responding to a referral to CPS took 101 hours for a CPS unit to respond. In 2020, it was lowered to 97 hours, 21, 83, and then in 2022, it started to tick back up again to 93 hours for a CPS team to respond. And now in 2023, it's 102 hours. So that is a new record there post-pandemic, where the amount of time it is taking for a CPS department to respond to a referral that is made is gradually increasing now. The report, as you go through it, it's not all doom and gloom. The total number of child victims has steadily decreased since 2019, and there's some other statistics there that give glimmers of progress as well. But especially the statistic where it shows the average response time is just gradually increasing for a CPS department is concerning from our perspective, looking at these departments and trying to figure out ways to increase efficiency and assist them going forward. So again, this increased demand, as we see on the slide, is due to population growth in certain areas, higher reports of child abuse and neglect, as we just discussed, and increasingly complex family environments. Okay. So again, some commentary on the current landscape. Demand for caseworkers has overtaken supply in approximately the last 20 years. There's strong competition from adjacent departments. If I'm a CPS caseworker and I'm burned out doing my cases and my caseload is too high, and I look over at other areas where they don't have to deal with the stress, same stress of, they might have high caseloads, but they don't have the stress of going into family homes or going through traumatic experiences and assisting them with those. And you can look at TA or SNAP or Medicaid or other areas, social services that folks oftentimes transfer to, or even foster care or preventive services that are less on the front lines of the issues that CPS sees. You also see folks transfer over to neighboring fields of work where you have higher wages and less stress, typically in schools, hospitals, and nonprofits. So there's that stressor there. There's that squeeze of having other opportunities for folks who are coming in a recruitment cycle and then moving on to other areas. Now, both rural and urban environments have these challenges. Rural areas typically have fewer qualified workers, less universities, more rural population. You're not going to have people who are graduating with bachelor's degrees just walking into town. In urban agencies, you face higher caseloads and increased burnout. So they both have unique challenges. Okay, specifically in recruitment, what challenges do we see there? There's the public perception, right? Negative news travels far quicker than positive news, especially when we talk about child welfare. You don't see the positive stories. You don't see the case of the kid where you prevented something happening down the road. That prevention scenario, the negative scenario that did not happen, can't be reported because you did prevent it from happening. The vast majority of the news reports will highlight negative issues with CPS. It's just the nature of the market, the nature of the news cycle. It's unfortunate, but we all know it's true. There's also the competitive job market that we just discussed. So the average salary for a CPS worker, starting salary in New York State is approximately $49,000, but in many rural counties that drops down to the low 40s. While the average starting pay for a college graduate, with a 4-year degree is $53,000. So there's the rub there, and also the educational requirements that come with having that job. You have to pay for your bachelor's degree that you just obtained to be able to qualify for a CPS position. But that average salary that this person will receive does not make it a feasible opportunity for most people. A lot of people that we speak to who come in almost enter it as a calling for them, something that they want to do no matter what, right? It is in their blood. It is something that they are looking towards as a long-term thing that they are dedicated to. Those are the folks that when we see, you want to highlight, but it's oftentimes rare. And then lastly, the workplace environment. Safety of workers in the field is a common concern for potential applicants. Additionally, if they apply and obtain a position in the county can quickly lose them if they're having to absorb cases of workers who just left. So, when you get a person who is fresh off a new class of training, comes into a department, and you just had 3 people leave your department in the last 2 months, and you need to give their cases to someone, well, guess who's going to probably get it? The new recruit who is left with a pile of cases that are oftentimes disorganized, haven't seen their clients in several months, and they're going to wonder which way's up. And it won't be a surprise to anyone when that worker becomes overwhelmed and burned out. Okay, so that's enough of the negative news in recruitment. We all know the challenges that are there, but what are some positive elements of it? What are some ways that states and counties have tried to tackle it? So one way is through stipends and specialized child welfare casework in schools. So in California, this program provided an average of $15,000 stipend per year for an undergraduate and $19,000 for graduate work. So basically what happens is a student would commit 1 year in child welfare for each year that they received the stipend. So if they got 2 years at 15 grand, they would be committing 2 years to working in that field. Additionally, it wasn't solely just a stipend, but their core social work classes would focus on child maltreatment, foster care law, and adoption policy. So they would structure part of the program and classes specifically towards them entering into the child welfare group. Now, this program started in the 90s, and it significantly increased the number of professionally trained social workers in child welfare, and has become a main way for California to obtain workers in the past several decades. Another opportunity, way to improve recruitment, is through specialized internships, right? So this program through the University of Wisconsin-Madison, the Child Welfare Field Placement Program, it offers specialized internships and assists them with basically understanding what's going to happen when you get in this desk after you graduate. So a student will work under an experienced field instructor during their time there and assist with home visits, safety assessments, court proceedings, case planning, anything that can give that student a full understanding of what their career is going to be like, right? And have them thinking about that ahead of time, being able to prepare themselves. When they did this, when Wisconsin-Madison did this, they found that new recruits had less initial shock during field work, and they were able to adapt more quickly than those who were hired outside the program. Okay. Factors contributing to high turnover, another critical issue, right? The emotional toll, the daily exposure to the effects of child abuse, neglect, or family crisis obviously has a broad effect on the workers there. The caseload volume, the workload, this isn't a surprise to anyone, but those with the highest caseloads indicate their greatest dissatisfaction and stress with their job. And with the administrative burden, paperwork requirements, especially those related to legal duties, visitation, miscellaneous family requests if you're in preventive or foster care. These pile up. I think the administrative burden one is the one that is oftentimes most surprising to folks. People, like we talked about previously, have heard all about the issues that they have, the child welfare has with visiting families and dealing with stressful environments, but then the administrative burden is almost unexpected to the new caseworkers, especially legal duties such as testifying and preparing case summaries is often something that they felt unprepared for. What is the impact of this? What's the impact of high turnover? Delays in service implementation. We've seen this many times, especially when a case is transferred from CPS to preventive or foster care to those divisions. If say that division, say preventive and foster care is experiencing high turnover, when a case is transferred over, it might sit there for months awaiting opening and receiving services that are needed that were indicated during the time it was a CPS case. So that is one of the cracks that cases often fall into. If the family may become unmonitored during a high turnover environment. Remember that one instance, I remember one of our engagements where a preventive worker left the department and they had properly prepared a case for closing, but the supervisor never completed their review and the case remained open for many months. It was like over 6 months. And ultimately, a child fatality did occur in that case. Now, the person that had left had prepared the case for closing, but when they left, the stack of cases went on the supervisor's decks and became that pile of I'll get to it later. And as a result, 6-8 months down the line, there was a fatality on an open case. So it can result with a family being unmonitored and sometimes a very difficult situation occurring. Communication with collaterals and service providers. The effects of turnover extend beyond the agency and the client. It also hampers the work of service providers when they don't receive family updates or know who to contact in the department to continue their work. And also, as we all know, morale will suffer, right? The remaining caseworkers, their morale will suffer as they absorb more work, often the cases that are left in disarray. And inexperienced workers, we find, are often promoted before they are qualified. When we review organization charts with management and then the tenure of the supervisors, we often hear directors saying, yeah, this person's not really ready to be a supervisor, but promoting them is my only option. There's nobody else, right? I have to put this person in this seat because I literally have no one else to fill it. So it results in a bit of a blind leading the blind environment where new workers are reporting to inexperienced supervisors. All that leads to a snowball effect where one worker triggers a wave of additional exits. Okay. Now, strategies for retention, right? What can we do to assist with this, to mitigate the effects? New Jersey had a caseload reduction initiative where the state said, okay, we're going to cap caseloads at 12 to 15 families per caseworker and then hire additional staff to alleviate administrative tasks when those caps are met. And so within 2 years when this was implemented, turnover rates dropped from 25% to 15%. And the caseworkers, unsurprisingly reported higher job satisfaction. This may seem like a pie in the sky idea, right? Oh, great, yeah, good idea, caseload limits. But it's something that could be considered even at the county level. If there was an internal directive at a county to maintain reasonable caseloads and hire additional workers, especially case aides, if that cap is breached, that's something that could be implemented, I think, and used effectively in a department, even on a local level, okay? Next example, as we just spoke about case aides, Clark County, Nevada developed an administrative support specialist program where they would handle non-clerical tasks, documentation, data entry, and freeing caseworkers to focus on direct client interaction. And of course, this assisted the county greatly. And this is probably one of the main elements that we see used, we like to recommend for counties to implement when they are struggling with turnover and retention. It's a way to quickly get people in the seats. You don't have to, have somebody who has a 4-year degree being a case aide, but they can take a vast majority of that administrative burden away from the caseworker and assist them with their daily tasks. And so we'll hear from counties, well, we'd love to hire caseworkers, but no one's applying. We offer the exam. We have one county offer the exam like every few weeks, every 2 or 3 weeks, but nobody sits for it, right? This is where case aides can be very helpful, very useful for a county. And it's relatively easily implemented if you can get the support for it from the legislature. Another strategy for retention, Oklahoma had a secondary traumatic stress initiative. Basically, what would happen is this program highlights the importance of the people or emotional side of the equation. These caseworkers are in stressful environments, often without warning. They walk into a house and they see stuff that they didn't expect to see that day. And through exit interviews, Oklahoma identified secondary traumatic stress as a main reason why staff would quit after experiencing that. So the program that they developed involved the following elements: workshops and seminars, basically to help staff recognize warning signs for themselves, identify when they're experiencing this type of stress, supervisor education, teaching management how to respond to staff exhibiting signs of it, revising policies to support things like mental health days or flexible scheduling if someone is experiencing STS. And then periodic group sessions with a licensed counselor or say someone in management who's been trained in group support. This assists the department with acknowledging that, hey, this is a really stressful job. You're going to see things in here that 95% of the other people who go to work today will not see. And we want to help you out with it, okay? That gives buy-in to your workers, to the people who are committed to this position. It tells them that you are committed to them. This one, just briefly, Michigan had a similar mentorship and leadership track development program. Have to breeze through a few of these. Okay. Last element that I'm going to discuss today is a critical issue of progression and leadership in child welfare divisions. So the structure of child welfare departments often contributes to high turnover through unclear paths to advancement for individuals, few formal reviews occurring of employee performance, if ever, no financial incentive being there to perform at a higher level than other people, than your peers, and inadequate training once the next level is achieved, okay? Someone fills a seat as a supervisor. Oftentimes they're filling a position of someone who's already left. There's no one training them. There's no one telling them what to do day to day. No one giving them their cheat sheet that they've developed over the last 30 years of how to make my job easier. That's gone. That left with Susie out the door, right? Departments have little to no formal training for mid-level management, and it shows clearly in the work that is performed oftentimes. Okay, so one example of a way to mitigate that impact on your department is an Ohio county that we worked with had a training program for supervisory positions. So basically they would have internal classes for staff who were promoted to mid-level management, and it gave them a detailed understanding of the duties and expectations of supervisors. Now this would last for a period of like 6 months. They're learning the responsibilities and best practices. It was a fully developed program. It took them a few years to implement it, but they started with something simpler, right? You don't have to implement something that's 6 months long, obviously. But you could implement something that is a few days training or a couple of days, a couple afternoons every 2 months where a new supervisor is receiving training that will assist them in that position, because we find that that is, in many organizations that we work with, not just in child welfare, but mid-level management is an area where training and assisting them with now governing the people that they used to be peers to is sorely overlooked. Okay. In Kentucky, a similar structure where they provided a route for advancement. Caseworkers can move into supervisory roles after achieving a certain benchmark in performance and education. And this helps folks who are in a department, they love their job, but they want to see a structured route for their advancement. They care about assisting the families, and they also care about their career. They also care about performing well and doing the best job they can and being recognized for that. So when it is solely based on something like your tenure in the office, how long you've been sitting in that chair versus what you've actually done, it becomes an environment where folks don't see the need to strive and perform well. And then this is probably the last one I want to really hit on is providing feedback models that are, frequent, formal, and instructive to your workers. Having formal reviews for all your employees. And that should include both info from supervisors and their direct reports. Massachusetts implemented this model where they took a 360-degree feedback model approach, where feedback's gathered not only from supervisors, but also from peers, subordinates, and in some cases, partner agencies. So your workers deserve that, right? They deserve being able to understand where they stand in your department, knowing what's going well, how am I doing, what are my strengths, but also what are my weaknesses and what do you think I should improve upon? That's just giving them their due, right? That's giving them what they deserve as a worker in your department, as someone who can progress. So unsurprisingly, that assisted this Massachusetts department. And I think there's several other here that might be available in the slides later on, but I am going to skip most of these and allow Courtney time for her section here. And try not to gobble it all up.
All right, thanks, Josh. So fiscal and operational implications of technology. We're going to completely switch gears. So you're probably thinking, what is all this? So these are actual copies of various forms that different counties use for all different types of requirements, typically associated with child welfare, mostly in the foster care space. And then you see a very old and outdated cell phone. So we're going to go into, again, the implications of technology. Next slide, Josh.
I'm clicking it.
Down there.
Courtney, if you hover over bottom left of your screen.
Oh, I can do it?
Yes, you can. Sorry, I should have.
Oh.
Just click and hover bottom left. There you go.
It's got to be painful for everyone to watch.
I'm trying for my end, but it's
no. Oh,
you got it?
got to go back. Yeah, I'm not seeing it. Gotta go back to like slide 23.
There it is. Okay.
Okay, let's see. We can do this. Yeah, next slide. I can't.
Jeanette, are you able to move that?
Yeah, that's it. Okay.
There you go. Okay.
All right. So, all right. Apologize for that. So, so essentially, whether you are a large county, small county, whatever your demographics are, your two main challenges in terms of technology, whether it's fiscal or operational or related, again, you have these generational gaps, and then you have limitations of the required child welfare system. So you've got, some seasoned staff, maybe they've been there for 10, 15 years. They're reliant on processes that they've been doing for years. And then you've got, younger staff who essentially have gone through, college, potentially high school, and are really, they're becoming very technology savvy. So they are they're operating very differently. So if you tell, a newer staff that's coming in, you've got to print out all these forms, you've got to sign it, you've got to scan it, you've got to walk over to, Janice's desk. They might look at you like you're crazy. So, but again, you've got, staff who have been there forever who are really accustomed and set in their ways. So bridging this gap and bringing them up to, 2024 in technology is going to help you significantly. And then again, you've got these limitations of the required child welfare system, connections, whether you love it or hate it, it's not perfect. There are some limitations that we've encountered. So we're going to talk about more of that. So common opportunities to leverage technology. So paper forms, so you could see in that previous screen, we see a ton of paper forms being used for mostly, again, in the foster care space. So triage checklists, visitation, childcare movement. So you see a lot of people, children are moving from Courtney Handy's foster home to Josh Bill's foster home. The caseworkers are filling out paper forms, and then they're either handing it over to somebody or emailing it to someone. We see a lot, we work with one county where they literally had, and there was a screenshot of it in the previous slide deck, they were handwriting schedules for people for their visitations. And so naturally that was problematic. People who needed access to those schedules didn't have access. So a caseworker was relying on the parents to come in for visitation, to have them fill out some required forms. Well, Janet has that binder, it's in her desk, and now it's problematic. So paper forms, best, what we would recommend is if you can take a paper form and make it into an Adobe editable document, that way it doesn't need to be printed, it can be shared, people can write on it, or actually type on it, it doesn't need to be printed, doesn't need to be rescanned, really can help move things along. Inter-office messaging like a Teams, if you don't have these implemented, again, they're very effective for inter-office messaging, a question, or, again, you've got younger staff coming in who are used to text messaging, and they might be more comfortable sending a message to a supervisor, or might be, more likely to do that than having to get up and, walk down a flight of stairs, or potentially have to go to a separate building to ask a question. So if you're hesitant, thinking that, it's just going to lead to a lot of, lack of productivity and people messaging each other, you could always pilot it with a smaller number of people. But again, it's going to help those communications for just simple questions much more easier. And then methods of retaining and sharing information. So again, especially in the foster care space, there is a lot of information that multiple people in various departments are relying on. So whether that's legal documents, whether that's visitation schedules, and so a shared document can be unbelievably helpful. Here's a shared space, shared document. We use it at our firm. Again, you can modify user roles. So certain people will have access to edit the document. Some people will only have access to read the documents, so you can maintain the integrity of those documents. But again, we see a lot of times, a particular clerk needs a petition and a court order, and Cindy sent it out in an email to someone last month, and so they're going back to them. It's causing hostility and issues. And it's like, well, if they just put the documents in a shared space so that everyone who needed them have access to them, again, it's cutting back on emails, unnecessary back and forth. Again, these are unbelievably great methods. They're really easy to implement, and they can do a ton of benefit. Next slide. So the areas with the largest impact. So a document management application, again, to complement the functionality of connections. Again, so there are systems that actually do interface with connections, help with file sharing. Caseworkers can search case notes. They can complete releases of information and refer clients to services faster. So we're seeing more and more counties implement these types of technologies, and it's been very helpful. Next slide. Okay. Another one has really more to do with, child safety. So when we go into counties and we review cases, we always, obviously one of the most significant gaps that we look for, which tend to be most problematic in terms of child safety and well-being, are gaps in when children are being seen. OCFS has some pretty strict guidelines in terms of visiting children and the location of those visits. And again, you've got a ton of staff who are potentially overwhelmed with the caseload, newer staff, and those, it gets missed almost in every county that we've seen. So if you can, set up an application to automate that so that a supervisor is getting updates of, hey, we've got this one particular case, Jerry's working it and the children have not been seen for 9 weeks. We've got to get on that. Again, that could also be used for safety assessments and then FASPs that we see again in the ongoing preventive and foster care case side, that these things are getting missed and they're overdue. Next slide. Last but not least, this the foster care process. So this by far has the largest fiscal impact of any area that we have seen. And again, this is in every county. So I want you to think about your own county, your own department. So when you do have a child that's been removed and they're being placed into foster care, how many different people are involved in that process? So from a very high level point of view, you have the caseworker who has removed that child. You have somebody who is in charge of finding a home, whether that's somebody internally or you're relying on an external agency or a mix. You have somebody who is determining their per diem rate. You have somebody who is determining 4E eligibility. You have somebody who is coding 4E eligibility determinations in WMS. And then you have somebody who is processing vendor payments every single month. So what are your processes and your controls to make sure that everyone is relying on the same set of information and that you are not, again, missing opportunities for federal reimbursements? You are able to track children so that when you pull up, whether it's Monday morning, Friday afternoon, exactly all the children in care, how many you have and where they are. And then again, you're not overpaying vendors. So I can going to get into a little bit more specifics with this. Again, we see, most counties, there's a placement module within Connections that can track some of this information, but most counties have it on lockdown. And so, one person is one or two, a handful of people are responsible for entering those movements, and they are relying on emails and paper forms from caseworkers to communicate a ton of information. So, and again, you've got external agencies who most counties do rely on to supplement their foster homes and this type of casework. So again, thinking about what you are doing to make sure all the children you have in care at any given moment, and you might say, what, I can generate a report out of Connections. I get this automated from the state every month. I know exactly how many kids we have in care. I guarantee if you took that spreadsheet, that report from Cognos, and you bumped it up against somebody in your department who is maintaining a list of children in care and where they are, there's going to be some discrepancies. And again, there is a cost associated with every one of these children in care. Again, you want to make sure you're maximizing your federal reimbursement. So what are your controls? What are your processes, to make sure that your 4E eligibility determinations are accurate? And you might say, we've got somebody, she's been doing it for 20 years. She's excellent. OCFS comes in and performs audits, and we have never had a single issue. That's outstanding. However, OCFS doesn't look at any of your non-4E cases. So that's something we always like to do. It's usually a pretty quick and easy identification of lost dollars, because again, you've got somebody who's determining eligibility and typically somebody else coding in WMS. And there's a lot of different circumstances that can change and can affect that coding. And so if there is not appropriate oversight or reconciliation, things get missed, things get miscoded all the time. Again, we always look, best practice to look at cases that are coded non-4E, because there's always a likelihood that, a rule was misinterpreted. Some of these cases get pretty wonky. Circumstances are pretty unique. And so again, you've got somebody who you've been relying on to do these reviews. Maybe they were out for a couple of weeks, or you had somebody in there for a particular amount of time who hadn't gotten trained really well and just made an error, and it's costing you, thousands and thousands of dollars. Another thing that we see, again, not overpaying vendors. With all of these children coming into care, they're getting moved. So if a kid comes into care with me, I go on vacation, they go into Josh Bill's house in respite. The caseworker doesn't communicate it to the appropriate people on time. You're issuing a payment to me at the end of the month, and then you've got Josh Bill's calling to say, hey, I had these children on respite. Where is my money? So here, time and time again throughout counties, it's just an administrative nightmare trying to reissue the payment, reclaim the funds from me. Another big thing that we are seeing with lost reimbursement is these QRTP, so children being placed in these agencies. The government has come down with some strict timing guidelines. So again, if you don't have a very robust, streamlined process in place, you've got a caseworker who comes in who's relatively new, places a child in some sort of agency, doesn't tell the right people, a QI assessment doesn't get completed within 30 days, or it gets set for a court date that gets pushed back and you miss that 60-day requirement, you lose out on those funds. So again, making sure you have a very robust process in place to prevent these types of things. So I will say, this has again been the area that we've seen the largest fiscal impact for counties. We wanted, one of our, things that we pride ourselves on are coming up with feasible recommendations for our clients. There isn't an application out there that we're aware of that can do all this and streamline this. So we have essentially created an application that centralizes this and has an automated workflow so that everyone involved in this entire process has access to updated information, and you can rely on, again, robust reporting so that you can make sure that you're maximizing your federal reimbursement and you're not overpaying vendors. Next slide. Policies, procedures, and protocols. So this is our last section. It's going to kind of pull everything in. So it's really the 3 Ps. So policies, procedures, and protocols, you want to make sure that they are established, they're documented, they're reviewed by leadership, they're available in an easy to locate shared space, and they're updated on an as needed basis. A lot of times when we talk to caseworkers in our interviews, we ask them questions. Yeah, I think we have a policy. I've never seen one. We hear that a lot. So what good does it do if you have a policy and no one knows where it is? So here are the biggest issue, the kind of the main aspects of child welfare where we think the policies, procedures, and protocols are most critical. So intake and screening. So how do SCR reports come in and how are they getting distributed to various caseworkers? So everyone should have a particular process, but again, you might have one person who's handling it and she's got it down and she has a system. What if she's out? What is that process to say, okay, we're going to give it to, what caseworkers are on rotation? How are caseworkers getting off rotation? Whether it's they have a certain amount of new cases or they have certain cases where they're required to be in court. And so that's going to take them off rotation. But again, having documented guidelines, so there's consistency is critical. For counties who are still offer FAR, we see cases coming in, again, what cases qualify as CPS versus FAR, making sure that criteria is documented and reviewing it because you want to look at trends in the department, in the community. And so certain cases that were CPS, maybe you want to switch them over to FAR and vice versa. But again, having a well-documented process for the intake and screening is pretty critical. Accepting and closing preventive cases, especially for these non-court ordered voluntary cases. When we review our cases, one of the things we do is how long have these cases been outstanding? And they're pretty, they're not black and white. So if you've got a preventive case where it's been open for 4 years, well, what are we doing here? And again, we look at these cases and sometimes we see these caseworkers doing a lot of transporting families to get groceries and getting their medicines, and what is acceptable and what is not acceptable. Again, these caseworkers may be keeping these cases open because they've got a relationship with these family, and it might be easier to do than take on brand new cases with brand new challenges. So really making sure that you have some procedures, some policies around not only accepting these non-court ordered cases, but closing them as well. Another thing that we look at that is beyond the scope of the OMA tool is these case transitions. So whether a case is getting transitioned to preventive or foster care, there's a lot of things that is required, and we find a lot of gaps kind of within that transitional period. So you're looking at a case and who is in charge of, during that transitional period, so seeing the children, who is in charge of getting those referrals sent out. So we look at a case and, 6 months after children have been placed into care, kind of everything has been reestablished. But again, that transitional period, we really look at to see, okay, are you having case conferences? Do you have very strict guidelines in terms of what the removing caseworker is responsible for, what needs to be done before it gets transitioned, and then when does a foster care or preventive worker take over? And again, what does that entail? Removals with the legal department. This is becoming probably more of an issue in recent times. So, what happens if a caseworker, new or old, wants to file a petition for removal? What are the protocols? Do they go to their supervisor? How does a supervisor, how do they communicate that with legal? Is it the director of services making a phone call? Is it the caseworker filling out a form? We worked with one county and it was, a huge problem, and we spoke to both sides. And again, there was no consistency in timing and the amount of information that was getting sent over, no shared document. So you've got emails. And again, the process for communicating these removals and expecting to get a petition filed varied, based on the caseworker, and you've got additional complications with their newer caseworkers. So making sure that you have protocol in place for it. Hey, if you are removing a child, you want to file a petition, this is what you need to do. Also, what is critical is, hey, you want to remove a child, your supervisor has agreed that there is enough to file, and legal says there's not enough to file, right? So again, there's some gray areas. So what are the caseworker and supervisor, what is their responsibility to do in the event that they've elevated this to legal and legal will not pursue it? Last but not least, visitation and transportation. You'd be shocked at the amount of, the logistics behind just scheduling visitation and transportation. You've got foster care children, you have their foster homes, you've got the biological parents, whomever the children were removed from. There's a lot of moving parts. People are canceling, they're pushing things back, they're not showing up. You're relying on external vendors to help supplement with this. Making sure you have a very robust documented process. Again, hopefully you're not relying on paper forms to schedule out your caseworkers to supervise these visitations, and you've got that process down, because again, if you've got 100 kids in care that you need to coordinate their visitation, transportation, and you look also at a staffing level, and you don't have the appropriate people, the staffing complement for that, it's going to crumble. So again, wanting to look at that, making sure that you have very specific policies and procedures and protocol for that process. All right, I don't know if we've got enough time for, yes, any questions. And again, you will have access to this slide deck, and you have our contact information if you do have any additional questions or feedback or comments for us.
This is Mark Levine. I'm the Deputy Director of the New York State Association of Counties. I had to hop on a little bit late, but I caught most of this presentation. And first and foremost, to Courtney and Joshua, I want to say thank you for this presentation and your expertise. And thank you for Bonadio. I know that, and we've had conversations with your team on a number of occasions. We know that you've stepped in and helped some counties through audits of their child welfare processes and systems, and we appreciate that work that you do on behalf of our counties. Counties do a lot, and one of the things that we do is child welfare, and it's a lot of what counties do is invisible, and this is one of those areas I think that is invisible to most of our communities. Except for when it lands on the front page of the local newspaper. And so you've both given us a lot of information here, but I want to ask a simple question, and the answer is probably not so simple, but what are the top 3 or 4 things a county can do to make sure they don't land on the front page of their local newspaper?
It's a pretty loaded question. Okay, I can start, and then if or Josh or Tim want to chime in with anything. I think number 1 is obviously child safety. So making sure that children are being seen, making sure that caseworkers, children are seen early and often. Again, when there's gaps in children being seen, things fall through the cracks. Making sure there's an elevation process. So again, if a caseworker is confused about something that they're seeing or that they're hearing while in a case, making sure that they have that, they can go to a supervisor, they know exactly what's to happen, what entails when you want to file a petition, make it very black and white of what is required for them. Because again, if they don't know, they're going to be hesitant and maybe they just don't pursue it. And then, a tragedy happens. And again, really monitoring these cases to make sure that children are being seen, because too many times with the amount of work and the staffing issues, children are not being seen. And it's, if you can monitor that and prevent that from happening, I mean, that's definitely.
Yeah, I think it also goes back to what we were talking about, turnover, and those cases that get lost in the cracks, Mark, where a caseworker might leave the department and their case is sitting on someone's desk for 6 months and it's been open for that period of time and no one has seen the kids. So having an understanding of which cases are out there on the loose and not really responsible by any particular person on their team, and what cases have been open the most amount of time and who has those cases. Is it a particular individual on the team? And really focusing on that individual, not in a negative perspective, but assisting them with crushing through their casework, getting through it in the way that's effective, and maybe divvying up some of those cases to other folks or their supervisor and making it in a way that is manageable. But those are usually where we see cases ending up on the front page and in a bad way for the department, where there are those gaps there.
Yeah, so you want to prioritize child safety above all else. So using data, to ensure that there aren't any gaps in casework, and then training. Again, you don't want to just rely on OCFS's training for these new caseworkers. You want to have a very robust supplementary training program. And again, training shouldn't stop just because there's new caseworkers. Ongoing training for caseworkers is really critical as well.
Great, thank you very much. I know that was not the easiest question to answer. At this point, we don't have any questions in the queue from our attendees, but I would invite our attendees, if you have questions after the end of this webinar, you can submit them to myself, Mark Levine, mlevine at nisac.org, or Jeanette Stanziano, jstanziano at nisac.org. We will get them to Courtney and David Courtney and Joshua to get those answered and back to you. I want to thank you for joining us this morning. I want to thank Bonadio and Courtney and Joshua again for your expertise and lending your time to our members this morning. I still have lots of questions, and I know you have lots of answers, but you covered a great deal of issue areas in the child welfare program, from the fiscal areas to political to social to legal and to policies that counties have and can hone and improve to support their child welfare programs. So thank you very much. Have a wonderful day, everyone. And we will be posting the recording of this webinar on the NYSAC website. That's nysac.org later this afternoon. Thank you.
Thank you, Mike.